Hello everyone, this is the first video for phlebotomy. So this is the video which is going to talk about some of the aspects of safety concerns around phlebotomy. We would normally go through a list of safety concerns with you, so it might be an idea is once you've watched these videos is to write down a list to yourself of things that worry you or concern you about taking your blood samples from patients, and maybe then re-watch the videos to see if we answer those safety concerns, or you can bring them to your Q&A session which we're going to do with you before you start your Clinical Skills 1 placement at Christmas. For this video, we're going to talk about what is one of the most concerning things about phlebotomy, and that is making sure you identify your patient correctly. It's such an important part of phlebotomy, and it's the easiest thing to do wrong or neglect. Yet it's the thing that if you do wrong, or you do neglect, or you don't do it correctly, it can actually result in the death of the patient, which would be your responsibility if you didn't identify the patient correctly. And it's something that we really can't stress enough how important it is. If you are going to be trying to perform any practical skill, you obviously need to introduce yourself to your patient, you need to state your role, you need to say why you're there and possibly offer an explanation to the practical procedure you're going to be performing, and then gain consent. And that is the same for any practical skill you do. Once you've got all that, you can then identify the patient correctly. So you'll need something with you which will then have the patient's details on, which is what you're going to use to label your sample bottles. If it's a blood transfusion sample, it'll be a bit of paper with the patient information on, and if it's a standard blood sample, it'll be the patient's e-care record. Now this is a simulated patient, so don't worry, we haven't got any secret record behind us. So if you are going to identify someone, first of all we ask you to do is verbally identify them. So and we want to make sure we do that by not giving them their name or the date of birth for them to say yes or no. We want to ask them to tell us their name and date of birth. So I would say to the patient, hello, my name's Tom, I'm a nurse, I'm here to take a blood sample, is that okay?
Yep, no problem.
So before we get started, can you please just tell me your name and date of birth?
Yes. Of course, I'm Sim Z. Damone, and my date of birth is the 1st of January 1968.
Brilliant. And I could check that against my record that I've got here. Next, what we would do, if we were using a paper form, we would then do a visual check, and I would then compare the paper form to the wristband that I've got in front of me, and I would check the name, the date of birth, and I would also check their hospital number, what we call the MRN number, and that is 2016375 for this person. I would make sure they're all correct. So I know I had one form with the patient's details on, one patient in front of me, and I'll just be doing one blood sample and test on that patient. If we're using the computer system, the way we would do that is we would go to a section on the computer system called Specimen Collection, and then instead of actually visually looking at the sample, we would scan it with our scanner. And that then comes up and that checks the wristband to make sure we've got the correct patient. Once we've got all that, we can then go ahead and we're all happy, we know what we're doing, we can then go and take our blood sample from our patient, and we can collect the sample that we want. We've got it in bottles, we say thank you very much once we're all successful, after we're really well trained. And then once we've finished, we then need to label the blood sample, and we need to stand at the patient's bedside to label the sample. We can't walk away with an unlabeled sample because there's a chance that we might pick up a wrong bit of paper, we might put the wrong details on it. So if we had a paper form, we would need to hand write out at the bedside all the patient details that were required on the form, and we would need to sign the form and print on the form and write the date that we took the blood sample, the same as what we would do on the actual blood sample itself. There'll be a little label in the section on that. If it's for the normal blood, so non-blood transfusion samples, we can actually print out our labels. And so what we would want to do is we would want to, first of all, come to the sample that we took, so this was a brown bottle, and say collected, and then I would want to make sure that I print my labels, and then I would want to find the correct printer that I was going to print from, so I can take my scanner, scan my printer, or I can find it in the list if I really wanted to, and then I could print off my sample, and it would print off my label. Once I have my label, I could then peel it off, and I can stick it to my blood sample, making sure that it is the correct label that I've got here. And then once those are all labelled, we can thank a patient, leave the area tidy, make sure they've got everything they need, their table, their drink of water, and then we can go and send our samples to the lab. So another safety concern in phlebotomy is sharp safety. So this is your first introduction to sharp safety on the CGC course. And this is something that is going to apply to a lot of skills that we're going to be teaching you, which will involve needles. This is a safety concern that applies to both you and patients and anyone else around you, any other members of staff around you. It's important to note that needles are a particularly dangerous device to be stabbed by, because needles in healthcare are actually hollow. So if you've used it to take a blood sample, for example, it will be full of blood, and if you actually end up stabbing that into your skin, it can inject quite a large contaminant into your skin. So it's worth noting that you need to be extra careful with needles. In order to protect you, there are several things that we have apart from training to help you, and one of those is a sharps bin. So it's an example of the Sharp Smart device that we use at West Suffolk Hospital. They are mobile trolleys on wheels that you can bring with you to your patient, and when you're performing any practical skill which involves sharps, it should be within half an arm's reach of you. So you shouldn't have to reach or throw or do anything. You should be able to just place your sharp, take it directly out of your patient, and it doesn't go anywhere else, it just goes directly into the sharps bin. They have with them these convenient trays on the top which you can place all your equipment, so that's really nice. And when you collect the trolley, when they're not used on the ward, they should be closed in this position. When you want to use it, it's important that you pull the catch at the front back to reveal this little lip where you can put your finger, and then when you open the trolley, the tray will open and you'll have a place where you can place all of your sharps. If you've finished with your sharp and you've finished with your device and you want to dispose of it, you need to be able to place it into the sharps bin, and it should slowly drop into the sharps bin, and then the tray will go back so you won't be able to get to it. If the sharps bin is full when you open it, the tray won't lower all the way, it will stay up, it will stay full there, and you'll also be able to see that it's full at the side here. When you finish with your Sharp Smart device, it's important to close the lid, and so on either side of the actual hinge are these little buttons that just pull a catch away, so you can lower the lid down, pull the slider over, and then you're finished. You can place it where you found it on the ward. If it's full though, you want to seal it off and get a new one. So on the side there are some red catches that you put down and pull the side bits over, and that's only if it's full, if it's completely full. And then once those are over, it's sealed, and then it can be taken away and you can go and get another one. There'll be some more stored on the ward somewhere, or ask a nurse to help you with that. I really like these Sharp Smart devices, and there's a specific reason why I really like these Sharp Smart devices, and we'll see if you can guess what my reason is, and we'll ask you that question on your Q&A sessions before CS1. We'll find out. Okay, once you've that's your Sharp Smart device, so that's your sharp bin, so that should be with you every time you perform any sharp, any skill that involves a sharp. There are some other things, I'll let Teeny tell you about those.
Yeah, so Tom's talked about sharp safety, all the things we have, like he's just said, it's a sharp bin, but all of our needles in the trust have actually a safety device on them. So I'm just going to take this lid off here. As you can see, this coming out here is like a little sheath. So when you've used it to take a blood sample from a patient, it's really, really important to activate the sharps device, not with your finger, because there's only a bit of plastic, and there has been instances where people have activated it like that, and the sharps gone through the plastic. So activate it on a hard surface, like the corner of the sharps tray or something like that, and you hear it click. And as Tom said, straight in the sharps bin, not back in your tray, not on the patient's bed, straight in the sharps bin. There's a couple of, we'll go through all these when you do phlebotomy. There's also what we call a butterfly needle. And again, that has a sharp safety device where you just slide it up. Slide it up when you've used it, it clicks, and straight into the sharp bin like that. And then when you're finished, obviously, close it up.
If the worst does happen and you receive a sharps injury, there's some important steps to take, which we'll go through now. So the first thing you need to do is make sure you dispose of the sharp. We've got several documented cases of people who have been in their panic, they might have injured themselves further, or another member of staff. We don't need that sharp device anymore, we don't want to test it, it needs to go just into the sharps bin. Once you've done that, we'd encourage you to spend some time bleeding your wound, if it will bleed, under a warm tap, so you can try and, if you can, get rid of some of the contaminant that you might have received. Once you've bled that for an amount of time that you have decided, we can't give you a specific amount of time, we would ask you to cover the wound, and then you need to collect a patient addressograph label, tell a member of staff what's happened on the ward, and you need to either go, if it's within normal working hours, to occupational health, or if it's outside of working hours, to the emergency department, and tell them that you've received a contaminated sharps injury. They'll go through the next steps with you down there, but it's important to recognise that if you do receive sharps injury, you need to go to the occupational health or the emergency department as soon as possible, and definitely within the next 72 hours, but we recommend as soon as it's occurred. There are obviously steps that they'll go through, but we'll let the occupational health department go through those with you. And that's it for this video. Yeah. Okay. And then next we're going to talk about infection prevention. So the final safety concern that we really want to talk about is infection prevention. This is obviously a procedure where there is the chance of causing an infection. So for this procedure, the rule is that you must wear gloves. So before approaching your patient, we obviously want to make sure that you perform really good hand hygiene. Make sure that you clean that according to the World Health Organization guidelines, and that we need you to make sure that you get a pair of gloves on. So whatever size you are, we want you to put those on so you can then perform this skill safely for not only you but also the patient, so you're trying to protect them. If we are going to perform this skill, we are going to need to obviously look at the person's skin, try and find where we're going to be putting in the vein, and wherever we've decided to do that, we need to make sure that we clean the skin with 2% chlorhexidine, and we use these 2% chlorhexidine wipes, these Clinell wipes. If you are going to clean the skin, we recommend that you use the entire wipe, lots of different areas of the wipe, and you clean the skin for 30 seconds, in cleaning it in multiple different directions, making sure that you've cleaned a really good area.
I'm very clean.
You are very clean. Now, try not to look at your wipe when you come away from it, just to see if there's anything come off there, which is a habit I must try and break myself, but I do try every day to break that habit. Once you've cleaned the skin, the alcohol itself only really kills the bacteria when it's dry. And if you do get alcohol into a cut, which I'm sure you've realised already, that really hurts. And also the alcohol of the wipes can damage the blood sample if it gets onto the blood sample. So essentially, it's really important to make sure the alcohol's dry before you actually stick the needle in the vein. Because if you don't, it hasn't worked, it will hurt the person, and it might damage the blood sample you're doing. So it'll make it completely pointless. Don't blow on the alcohol, just let it dry, and it should dry relatively quickly because your patient's warm, so it should evaporate and dry really quickly. Once you've cleaned it though, you can't touch the site anymore, and you can only touch the site with something that is sterile. So once it's cleaned, that's all done. Okay, thank you very much. So that's the end of the safety videos. Now we're going to talk about preparation.
Thank you.